Welcome to Be Aware, Beat Cancer. A podcast series that brings to you expert insights on cancer screening, prevention, and its treatment. Today, we have with us Dr. Vishwanath S, a professor and senior medical consultant oncologist. Welcome to the show, Dr. Vishwanath.
Yeah, thank you, Preja, and thanks for having me here today.
Today, we will be discussing about the necessity of early screening for cancer prevention. So, let's just get straight into it. And I'll ask you my first question. How important, rather, why do you think cancer screening should be a part of your annual health checkup?
That's a great question to start with. So, first of all, we need to know what screening is. Screening is nothing but just doing a physical examination or doing certain investigations to diagnose cancer early. That way, these patients, most of them, end up getting cured or have a long-term survival. That's the whole idea of screening. So, there are certain cancers which can be screened. To start with, we know that breast cancer is one of the most common cancers in India. A woman with the average risk of having a breast cancer is generally asked to get a mammogram once a year after the age of 40, and also to visit a healthcare professional every year after the age of 40. And then there's something called breast self-examination, as most of us know. We all have YouTube videos for that. And breast self-examination after menstruation every month goes a long way in actually helping women detect breast cancer early. So this is about breast cancer, and we know that by doing these methodologies, we are able to diagnose breast cancer early, and these patients have a very good survival, and some of them also end up getting cured. And now the other common cancer amongst women is cervical cancer. Cervical cancer again has got a very good screening program, and what we do is we do a simple test called pap smear, which is done after the age of 21 years, and it's done every 3 years. And then it's a very simple test which your gynecologist can do, and it's also done very commonly in the rural setup as well. And this goes a long way in diagnosing cervical cancer early. And then we also club it with what we call as the HPV testing, or human papilloma virus testing, which is done once in 5 years. This goes on every 3 years and 5 years for till from the age of 21 till 65 years of age. And then we have the lung cancer. Lung cancer is one of the common cancers in India. In men and in women, it's catching up. So for lung cancer, we have a specific subset of individuals where we do this test called low-dose CT scan. It's not the conventional CT scan. The low-dose CT scan, where the amount of radiation is very less as compared to the conventional CT scan, and we do it specifically in individuals, men or women, who smoke, who've been smoking for the last 30 years, 1 pack a day. That constitutes what is called as 30 pack years, and then over the age of 50 or 55. These individuals are asked to get a low-dose CT scan every year, and we are able to detect lung cancer early, and again we are able to give them the right kind of treatment and also inch towards cure. Shift focus to colorectal cancer. Colorectal cancer, again, though once considered the disease of the West, it's catching up significantly in India, probably because of the westernized diet. And over the age of 50, what we do is we recommend a colonoscopy every 10 years, and this again can help in diagnosing colorectal cancer early. And we do know that colorectal cancer, if diagnosed early, most of them can be cured. That's about colorectal cancer. And then we have prostate cancer. Prostate cancer, again, a disease of the men. Over the age of 50, an average risk man just needs to go to the urologist or his medical professional once a year and do what is called as the simple blood test called PSA, which is prostate specific antigen. And along with that, the urologist or the medical professional also does a digital examination of the rectum. It's called PR. And that way you can see feel the consistency of the prostate.
Okay.
And again, it can help in diagnosing prostate cancer early. So this way, these 5 malignancies, prostate, lung, colorectum, breast, cervix, these are all the cancers which have a very robust screening program, and we are able to diagnose these patients early and give a very good prognosis.
So, can cancer be prevented? How do you reduce the risk of cancer?
So that's a wonderful question again. So prevention is again a very, very difficult question to answer. How do we prevent something? Of course, one of the most important things which I mentioned before was screening. So screening is one way of picking up things early. May not be a direct prevention, but diagnosing it early, and these patients have a long-term good survival. Apart from this, your 40 to 50% of our cancers are all habits driven. So your lifestyle choices: eat healthy, lot of fruits, lot of vegetables, plenty of antioxidants these fruits and vegetables have. So try to get into that, that adopt that lifestyle. Apart from that, exercise and keep yourself very active and healthy. And obesity, as we know, is one of the risk factors for several cancers, and make sure that you are quite active and keep your body mass index within the range. And then several environmental factors. It's very difficult to stop your exposure to pollutants, but then wherever you're exposed to, you can probably use the N95 mask. And smoking, there's something called first hand smoke, second hand smoke, and third hand smoke. Even if you're not a smoker, of course, if you're a smoker, please abstain today, don't delay. And if you have never smoked, please make sure that you never ever smoke in your life. And then if you're a second hand smoker, what we call as passive smoking, make sure that you're away from smokers. And there's something called third hand smoke, where a person may just smoke and then walks out of the room, and then you come in and there's a lot of carcinogens in the room. This is called third hand smoke. So make sure that you are kind of away from second hand and third hand smoke. And then alcohol, limit alcohol. In fact, recently there was the American surgeon had actually given guidelines about any amount of alcohol not being good for health, in the sense it's injurious, and it's better to abstain from alcohol throughout. It's very easy to say, but then this is something which we should try to practice. And these are all the different factors which go a long way in preventing smoking. And then of course you reduce the stress levels, do yoga, meditation, and then sleep hygiene. Most of us, with our busy workloads and addicted to WhatsApp and whatnot, I think we have to go for a digital detox, and then make sure that you have a good sleep hygiene as well.
How important role does genetics play in cancer?
So there are two types of cancer. Broadly speaking, it's divided into what you call as hereditary. Like you said, it's familial and it runs in families. And then there are other set of cancers which are sporadic. It's just a matter of chance. So when we talk about hereditary association or familial association, broadly around 10 to 20% of cancers we see in our day-to-day practice are all familial, or it runs in the families. There are certain genes like the BR, and unfortunately these are non-modifiable. It is what it is. And we have certain genes called BRCA1, BRCA2. There are certain syndromes like Lee-Fromeny syndrome, Lynch syndrome, multiple syndromes. So around 10 to 20% are familial and genetically determined, and that's where we do certain tests which could be in the blood, or we also do it in the tissue. Like, just to give an example of this BRCA1 and BRCA2, we do what is called as the germline testing, which is done in the blood, and then there is something called somatic testing, which we do it in the tissue, on the tissue. So there are different types of tests, and we also have a good genetic counselor to assist us, and they go over the entire family history, what we call as a pedigree chart, and dig deep, and the reasons why they're going to do a particular genetic test or not. And then of course there's something called pre-test counseling, counsel the family as well as the patient well. And then we always start with the index, the patient. We always run the test in the family only if the patient is positive. And then subsequently what is called as the post-test counseling. What do you do with the test if it comes positive? These are all things which have to be addressed, because it involves a lot of emotional turmoil, and it can lead to emotional turmoil. So we have to be very, very careful in doing this pre-test and post-test counseling.
So, what can you tell us about early onset cancer? And what are the early signs, rather warning signs of cancer?
So just to define what early onset cancer, we all know that cancer is not new. It's been there for years together, it's been there, but now with the improvement in the diagnostic modalities and the awareness, we've been picking up cancer probably more, the incidence rates are more, but of course contributed by several lifestyle factors and environmental factors. We know that the incidence has also significantly gone up. Now, early onset cancers are generally cancers which are diagnosed in patients who are less than 50 years of age. And these days, we are noticing that our patients are coming at probably 1 or 2 decades earlier. Just to give an example of breast cancer, which was probably previously a disease of the postmenopausal women over the age of 50, we are seeing that it's shifted 1 or 2 decades earlier, and we are seeing younger women in the 30s and 40s who are coming to our clinic for with the diagnosis of breast cancer. And what is also alarming is these patients end up having a way more aggressive histology or aggressive behavior. For instance, in breast cancer, what we call as triple negative breast cancer, and these patients end up behaving very aggressively. So again, several reasons like what we spoke: lifestyle, environmental pollutants, and when we talk about breast cancer, women are getting married later, probably after, and having the first child after 30 years. Some decide not to have a child. Again, those who do not breastfeed, attaining a early menarche. The menstruation starts earlier, and then there's a prolonged exposure of estrogen, and they have a late menopause. These are all the probably reasons why there's a paradigm shift in diagnosis of breast cancer by a year, by a decade or two. And then liver cancer, you have hepatitis B, which is one of the main causes for liver cirrhosis, end-stage liver disease, and then they end up getting liver cancer. So it's preventable. You can go ahead with the hepatitis B vaccination. So these are all the different thoughts which come to my mind. Yeah, generally, when patients come and tell me that, doctor, I've had no symptoms at all, it's again difficult to probably believe that. Symptoms could be subtle, but starting from head to toe, any oral sore or any sore in the body which does not heal for a long period of time, or you notice some pigmentation which is growing in size, or it's become thick and it's showing different pigmentations, then you have to think of skin cancer. And then bowel habits, if you have a diarrhea or constipation, and if you have belly pain which is going on for a long period of time, or you notice some blood in stools, then you need to think of something alarming. And then patients who lose weight, chronic loss of weight, loss of appetite, fatigue. We talk about lung cancer, they could present with chronic cough, hoarseness of voice, chest pain, and then breast lump, which is probably growing in size, which is involving the skin, some discharge from the nipple. And for women cancers, it could just be some chronic pelvic pain, urinary symptoms. They could have pain or bleeding after intercourse, sexual intercourse, or irregular menstruation. So all these are different warning signs and symptoms which patients, or certain lymph nodes which may appear. These are all the different warning signs and symptoms which are probably important for every individual to act upon and consult their healthcare professional.
And that brings me to my next question. Are there any misconceptions or myths surrounding self-screening, early detection itself, that prevents people from going to the doctor to get further checkup?
Yeah, so there are, again, it's multifactorial. When we talk about self-examination or self-screening, it's very well documented and in breast cancer. So like I said, women over the age of 40, every month after their menstruation, there's a way to do the self-examination of the breast, and it can actually detect breast cancers early. That way you can go to your healthcare professional. But there are also a lot of factors which probably are obstacles in this. One of the most important factors is the awareness. Second is accessibility to healthcare. We're not talking about Bangalore, we're talking about, say, a rural setup, a village. And patients are also having the stigma or fear about what could probably turn out to be some, say, a stage 4 cancer, and then they have that fear and stigma which is preventing patients from coming out and expressing themselves. And of course, the cost factor. And most of our patients, 50 to 60% of our patients in India are paying out of pocket. And even if they have insurance, it's limited. And most of the investigations, what we mentioned, is all out of pocket because it's all outpatient. We know that cancer insurances are usually taken care of only when the patients have an inpatient, have an admission, there's a procedure. So, multiple factors come in to play, especially when we're talking about patients coming out and expressing themselves or showing to a healthcare professional.
So, what role does communities play in cancer prevention?
It's very vital, and even in your apartments, your large communities, you have around 5,000, 6,000 people living in a community, and you have WhatsApp, and in India, WhatsApp is being used for everything. So that way, it's awareness campaigns, awareness messages, and even we as healthcare professionals, we try to do something in our communities, and paper pamphlets distributed to different communities and through newspapers. All these can go a long way in probably reducing these challenges, and more people coming out for screening and diagnosing cancer early, and probably making cancer history.
So, doctor, that brings me to my last question. Is it true that early detection helps in improved survival rates?
Yes, it's proven beyond doubt that early diagnosis has significantly improved the outcomes of patients. And if you, just to give some figures, the 5-year survival of, say, the best possible subset of breast cancer who are diagnosed early, what we call as the hormone receptor positive HER2 negative breast cancer, there's the 5-year survival is 99%. Cervical cancer diagnosed early, most of them are curable. And colorectal cancer, like I said, stage 1, stage 2, most of them are curable. So that way, I think screening has made a major difference, and it's not only improved the outcomes, it's also, when we talk about stage 4 cancers, cancer being diagnosed late, immunotherapy, targeted therapy, these drugs are very expensive. It also puts a huge economic burden on the family, economic, emotional. It's multiple, it's exponential. I've seen patients and their caregivers. So that comes down. Cancer being diagnosed early, you'll be able to just finish the surgery and then some chemo, and then you're done with it. So economic burden is reduced, and the quality of life is improved. So again, it's definitely, screening has made a huge difference.
Thank you so much, Dr. Vishwanath, for your valuable insight. And that brings us to the end of this episode of Be Aware, Beat Cancer. As you heard him, early detection can save lives. So until next time, stay healthy, be happy, and thank you for watching.